Hi, good morning. I'm Grace Snow. I'm a laryngologist at University of Maryland, and I did my fellowship with Dr. Axt over at Hopkins. So I'm going to talk about laser applications for laryngology, not in the OR, but actually in the office. And I don't have any disclosures. So as Dr. Axt mentioned, there are a few different indications in laryngology where we will use lasers. One indication is benign vocal fold lesions like polyps, vascular ectasias, cysts, granulomas, or papilloma, which is caused by the HPV virus. And here are some pictures kind of demonstrating what a hemorrhagic polyp on the vocal cord can look like and what papilloma can look like. And then another common time that we will use lasers is for premalignant vocal fold lesions, which are known as leukoplakia. So they're these kind of white patches that can form on the vocal cord, and they can contain dysplastic cells, and over time a certain percent of them will progress to malignancy if they're not treated. And we also will use lasers for recurrent lesions in an area of a previously treated early vocal cord cancer. In my practice, I primarily will use office-based lasers for papilloma and leukoplakia, but other people do use them for these other applications as well. And in particular, with treatment in the office, there is a risk of not being able to totally treat the disease as completely as you would in the operating room because it's an awake patient. So I think with any of these conditions with laser treatment in the office, there is a risk of having to retreat it, but particularly with papilloma and with leukoplakia because those can recur just due to the nature of the disease. So even if you completely ablate it with the laser in the office, it can come back later on just due to the natural history of the disease. The types of lasers that we use in laryngology in the office are the KTP laser, which Dr. Axt mentioned, and then the True Blue laser. And I think, the benefits of using lasers in the office is that you can avoid general anesthesia, which some patients prefer not to have general anesthesia. It can be cost saving because you're not having to go to the operating room and have all those associated costs. It is safe, really the main risks are you can have a nosebleed from passing the camera and the laser fiber through the nose. People can sometimes have a laryngospasm where the vocal cords will kind of like slam closed, and that can be an uncomfortable feeling, but it will go away on its own. Sometimes patients can become lightheaded or have a vasovagal episode, but otherwise it is quite safe and typically pretty well tolerated, and the voice outcomes are usually very good. The cons of using the laser in the office as opposed to doing it in the operating room are that you're trying to hit a moving target because it's an awake patient and the vocal cords are constantly moving. And it is a really sensitive part of the body because the vocal cords are designed to basically protect your airway. They're supposed to close if anything touches them, so it can be difficult to achieve adequate local anesthesia in some patients. And when you are doing a laser procedure in the office, you can also take biopsies of the vocal cords at the same time if you want to, but you cannot get as big of a piece of the vocal cords as you would be able to if the patient was asleep. So if you're trying to obtain a pathologic diagnosis, then you have a risk of getting too small of a sample for the pathologist to be able to make a definitive diagnosis. And you may need to do additional treatments either in the office or in the operating room if you cannot treat their disease fully. So this is how you would do a flexible laryngoscopy with laser ablation. So you use a flexible laryngoscope with a channel that you can put instruments and the laser fiber through. First, you have to numb up and decongest the patient's nose. And then you have to anesthetize the larynx. So there are different ways that you can do that. One is to drip topical lidocaine through the instrument channel of the scope. You can also inject topical lidocaine through the cricothyroid membrane, and that will basically feel pretty uncomfortable for the patient. It kind of feels like you swallowed a bunch of water and it went down the wrong way. It'll make the patient cough, and then that spreads the local anesthetic around to achieve anesthesia. So I always warn the patient that it's going to be uncomfortable, it's going to feel like they swallowed water and it went down the wrong way. And you can also do nebulized lidocaine as well. And then once the patient is adequately anesthetized, then you would start using the laser. So the way that we do it in my office is we rent a laser from a laser company. So there's like a representative that comes and brings the laser and brings the safety equipment, but some ENTs will also purchase a laser as well, so that's an option too. And so you have your laser safety precautions set up, which includes eye protection for the doctor and the patient and anybody else in the room, and then a smoke evacuator. Put the laser on the settings that you want it to be on, and then you insert the camera through the nose, look down at the vocal cords. You can touch the vocal cords with the tip of the camera to make sure that it's numb enough. Put the laser fiber in through the working channel and then ablate the lesion. And you do need to see them back about a month or two afterwards to make sure that it's healing up okay. And if it's a disease process like papilloma or leukoplakia where you expect it can recur over time, you need to continue to follow them. So this is a patient who I saw recently. It's a patient in his 70s who was actually never a smoker, didn't really have any risk factors for vocal cord cancer, and had a right vocal cord lesion that was removed about 6 years before he saw me by a different ENT. The pathology at that time had showed high-grade dysplasia. And then this lesion recurred over time, and his ENT referred him to me because he wanted to have an office-based procedure for it. So for me, looking at it, it looks like leukoplastia to me. It looks like it could be a pre-malignant lesion. It is kind of large relative to things that I will usually do in the office, but he wanted to have it done in the office. So this is a video of us ablating it with the laser here. You can see he's tolerating it pretty well.
Through your nose.
This is
and then,
the 6-week
again, just
post-procedure visit. So healed up pretty well. You can see that right vocal cord is vibrating nicely, which will lead to a good voice quality. There's a little small white patch that I will have to follow over time when I see him back. But I think overall pretty good outcome. So I think, to conclude, laser treatment of laryngeal disease in the office can be a good option if patients don't want to have general anesthesia. It's important to select patients carefully. There's a risk that you won't treat the disease fully and you'll need to repeat treatment, either due to the disease itself or to the incomplete treatment. And that is the end.
All right, thank you.